Hey everyone, we've got another heart. This is number 538 in our collection, and the heart would have sat in the chest as it sits on the turntable at the moment. So head or superior would have been here, inferior legs here, left here, right here, anterior coming out towards the screen, and posterior towards the turntable. And we'll start off as we usually do by trying to identify what at least externally appears to be a morphologic right atrial appendage. And here is what appears to be an externally, at least, right atrial appendage. It's triangular, broad-based, or pyramidal in shape. So we'll go ahead and open up the heart there. When we do that, we see there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We do find the oval window here, and it appears to be fairly intact. And then we also find the mouth of the coronary sinus, which is right here. And the mouth of the coronary sinus is going to be part of an important structure known as the triangle of Koch, which is bounded by the mouth of the coronary sinus, the tendon of Totaro, and the tricuspid valve hinge point here. And at the apex of this triangle is where we expect the atrioventricular node to sit. If we look at the right-sided atrioventricular junction, there does appear to be a 3-leaflet valve that guards this junction. This valve does have direct connections to the ventricular septum, consistent with the morphologic tricuspid valve. We would expect this to be a morphologic right ventricle, and there are coarse trabeculations, and there is a septomarginal trabeculation here. And now when we look at this ventricular septum, we find that there is in fact a ventricular septal defect here, and that this ventricular septal defect lives in the Y of the septal band, aka between the cranial and caudal limbs of the septomarginal trabeculation. So once again, here's the right ventricle, here is the septomarginal trabeculation, and the septomarginal trabeculation gives rise to its cranial and caudal limbs, a structure known as the Y of the septal band, and any defect that lives within this would then be an outlet type ventricular septal defect. Right. This defect is also completely bounded by muscle. So in fact, this is a muscular outlet intraventricular septal communication, or a muscular outlet VSD. As we get further into the right ventricular outflow tract here, we do find a 3-leaflet semilunar valve. 1, 2, 3. And it does not appear that there are any coronary arteries arising from this, consistent with a morphologic pulmonary valve. Remember, the pulmonary valve is supported entirely by muscle. And here we can see the pulmonary trunk externally here. All right, so once again, septomarginal trabeculation, Y of the septal band, and an outlet muscular VSD. So now let's go to the posterior aspect of this heart. Here we find another atrium. This is smooth-walled, consistent with a morphologic left atrium, and we do see some pulmonary veins coming back to the left-sided atrium here. We do find the left atrial appendage here, and we can see the pectinate muscles all confined within the appendage itself, consistent with a morphologic left atrium. We see that the left-sided atrioventricular junction is guarded by a 2-leaflet atrioventricular valve, and that this valve has no connections to the ventricular septum, consistent with a morphologic mitral valve. And here are the papillary muscles. We would then expect that this ventricle would be a morphologic left ventricle. It does have fine crisscross trabeculations consistent with the morphologic left ventricle. And then here we see the VSD from the left ventricular aspect, and once again see it as entirely bounded by muscle once again. Now what you can see here is that there does appear to be some posterior deviation of this outlet septum here. And there does seem to be some narrowing of the outflow tract here. There is another semilunar valve here that appears to have 3 leaflets. There's a coronary artery arising from one of these sinuses and from this one as well. So consistent with the morphologic aortic valve. And as usually seen, there is fibrous continuity between the anterior leaflet of the mitral valve and then some of the components of the aortic valve here. Here's the ascending aorta, and you can see that the ascending aorta appears smaller than the pulmonary trunk. So let's take a look at that from the anterior aspect once again. So now here's right ventricle, and here's the pulmonary trunk here, and here's the ascending aorta here. So you can see that there is a discrepancy between the size of the pulmonary trunk and the ascending aorta. And when we look at this aorta in a little more detail, we do see that the transverse arch here is also quite hypoplastic. So ascending aorta, transverse arch, and you can see kind of this boxed shaped appearance that people often comment on by echo. So a hypoplastic ascending aorta, hypoplastic transverse arch. And then the pulmonary artery, there is a patent arterial duct, which comes into the aortic arch. Here's the descending aorta here, and you can see that right at the level of the duct, which lives right here, is a significant narrowing and a shelf here consistent with coarctation. All right, so we do have a small aortic valve, a hypoplastic ascending aorta, which can be seen externally here as well, significant hypoplasia of the transverse arch, and then a frank coarctation. So an interesting heart with a muscular outlet ventricular septal defect, transverse arch hypoplasia, and coarctation.